viewers, welcome to another episode of Monitor Your Health, the program where we educate the public on contemporary health situations in the country. You're welcome to another program, and the topic today is going to be ectopic pregnancy. We have our guest, Dr. Kayode Amu, who is a gynecologist practicing in the UK. Dr. Amu, you're welcome to the program.
Thank you very much, Femi.
Yeah. So my name remains Dr. Femi Ogunremi, and please may the audience know you.
Right. Thank you once again for inviting me onto your program. So my name is Johnson Kayode Amu. I mean, probably people that know me from Nigeria where I trained, and then before moving to the United Kingdom, and where I specialized in obs and gynae. So yes, that's what I do. I'm a gynecologist by trade, and I've been a consultant for the last 8 years at Blackpool Teaching Hospital. Thank you.
Okay, thank you so much, and it's nice to have you here. So we're talking about ectopic pregnancy. Ectopic pregnancy is an issue that confuses people a lot. A lot of people at early pregnancy, they have pain and they can't make a thing of it. Today, we want you to help us to throw light into this so that our audience can go home with the knowledge that will prevent them from having the catastrophe that can happen through this condition. So what is ectopic pregnancy?
Right, I think that's a good place to start, really. So everybody thinks of pregnancy as always something wanted, ends up in a baby, and pregnancy normally will stay inside the womb cavity. So anything other than that, it is an ectopic pregnancy. So basically, a pregnancy that's not in the right place. The right place is the womb cavity. So anything outside of the womb cavity is described as ectopic pregnancy.
So what do we mean by the womb cavity, please?
So the womb cavity is where the baby grows inside. So the uterus or the womb is where the baby grows, and that's a natural place for it. But if pregnancy for some reason doesn't find itself in the womb cavity, it ends up in an ectopic pregnancy.
Sorry, carry on.
So it ends up
for a fraction of a second.
So it ends up being an ectopic pregnancy. Now, I suppose you're asking me, where could this pregnancy then end up? So it could end up on its way into the womb, which usually it's inside a tube, but also it could find itself on the ovary. It could even find itself inside the pelvis as well, or actually on the neck of the womb on its way probably out, or probably when you go for IVF treatment. So you could have ectopic pregnancy in different places other than the womb cavity, which is the natural abode for a normal pregnancy.
Okay, thank you so much. That sounds a bit scary. And so how common is this condition? Is it something that we need to worry about?
I think it's fairly common, I would say, and it's something that we need to have the knowledge of so that when things present that doesn't look normal, then at least at the back of our mind, we should be thinking of ectopic pregnancy, because it can be quite serious, I must say. So how common is it? We'd say probably about 1 or 2 pregnancies out of 100 could end up being an ectopic pregnancy. Now, this is the figures you see quoted in the UK, maybe 1 in 80 pregnancy, but generally it's 1 to 2 pregnancy in 100 that will end up as ectopic pregnancy. I did look at the Nigerian setting and then a few publications from Nigeria. The figures are slightly higher in Nigeria in the sense that you have probably 2 or 3 pregnancies out of 100 ending up as ectopic pregnancy. So that's how common it is, really.
Wow. Okay. So what makes it quite serious? Maybe we should just go into the presentation, or I don't know how you want us to take this. We would like to know the presentation, and would like to know how it actually happens in a lady.
So basically, like I said, I mean, people get pregnant and they're expectant of it, really. And in such situations, the next thing you want to do is to go for maybe an ultrasound scan to confirm the pregnancy. And then sometimes it becomes a shock, really, to say, well, yes, your pregnancy test is positive, but we can't see a pregnancy inside the womb cavity. Now, it could mean a few things. Probably it's a bit too early to pick it up in the womb cavity, or at that time as well, they may pick the pregnancy outside of the womb cavity. And like I said, the commonest place where you would find ectopic pregnancy is within the tube itself. The other places which are mentioned, like the ovaries, the neck of the womb, those ones are less than 1% of the time that you find ectopic pregnancies there. But in the tube itself, up to 90% of the time is where you find the ectopic pregnancy. Now, why are we talking about it? It can be quite serious because people have actually died from ectopic pregnancy, especially the ruptured ectopic pregnancy. And basically what I mean by that is that imagine the tube being quite a small place, and imagine the size of baby at the end of pregnancy. But at the early stages, of course, the womb kind of grows to allow the baby's growth as well. But within that tight space in the tube, the pregnancy can only grow so far. And if there's not enough space, it outgrows the tube, and that's when it ruptures and then it starts bleeding. Now, you could be quite lucky that when you go for ultrasound scan, they pick up the ectopic pregnancy sitting quietly somewhere without causing any problem. While for some people, it may just be that a woman probably just collapses, and then the next thing is like, why is this woman collapsed? And then, you might then do the scan and then find a lot of blood in the tummy. And these are the sort of women that if emergency treatment is not given, they end up dying as a result of it. So ectopic pregnancy can be quite serious. Up to 4 women out of 1,000 have died as a result of ectopic pregnancy. And this is why it's important that we all have the knowledge of the things to look out for that may suggest ectopic pregnancy. Now, how does it present? Unfortunately, a woman can be pregnant and then still have ectopic pregnancy and have the same symptoms of normal pregnancy, the morning sickness and things like that. And like I said, until you go for scan before that diagnosis coming, really, which in itself is breaking bad news if somebody has ectopic pregnancy. But also common things that may be associated with ectopic pregnancy could be abdominal pain with or without bleeding from the vagina. Now, these are the uncommon symptoms of a natural pregnancy, and that should actually trigger a suspicion to see what's going on. But also, there could be life-threatening presentation as well. When a woman feels faint, they look pale, or they might just collapse in the middle of something, really. And for those women, this is where investigations, or when you now take them to theater to find out the cause of the bleeding inside the tummy, they find out that they've got ectopic pregnancy. So that's the various presentation of how ectopic pregnancies can, or women can present with it. Now, what are the things that could make a woman, have ectopic pregnancy? This is where we talk about risk factors and all of that. Now, important thing is that a woman may not have any risk factors and just been unlucky to end up with an ectopic pregnancy. But common things that we know that could predispose a woman to ectopic pregnancy include things like pelvic inflammatory disease. And this is where we are talking about infection in the pelvis. And this could be either due to infections like chlamydia, gonorrhea. Any infection as such really could predispose to ectopic pregnancy. Having said that as well, a lot of people have challenges conceiving. And it's rather unfortunate that in the process of trying to achieve a pregnancy, you may end up going through the treatment and also end up with an ectopic pregnancy. So women that have problem with conceiving or women going through IVF treatment are also at risk of ectopic pregnancy. Also, things like, contraceptions most of the time will prevent pregnancies happening. But if that contraception fails, you need to have a high suspicion of ectopic pregnancy happening. Now, the other things we should consider, cesarean section is quite a common way of delivering babies. That in itself is a risk factor for ectopic pregnancy. And also women going for treatment of fibroid, something called myomectomy, where they may have cut in the womb. So any surgery inside the abdomen or pelvis could actually predispose to ectopic pregnancy. But like I said, there may not be any risk factor. It's just being pure unlucky, and then you end up with an ectopic pregnancy.
Wow. Thank you so much. That sounds a bit worrying, because the lady will be asking now, am I going to have a pregnancy? Because it sounds like there's so many things associated with this condition. So how do we then prevent ourselves? I know you've told us how it comes about and things like that. We could pick one or two things, but I want us to sum it up. What do we need to do? Practical things that a lady needs to do to prevent this before I then talk about how do we prevent it? Let's start from there.
So in terms of prevention, like I said, it's, the things that predisposes one are the things you're trying to avoid. Okay, trying to, in terms of healthy sexual relationship and lifestyle, is one of the key factors which I would say really as in preventing pregnancy, unwanted or ectopic pregnancy per se. Now, also the women that use emergency contraception as well, they are at risk of ectopic pregnancy. So that's another way of preventing. So healthy sexual lifestyle, it's really important. Unfortunately, you may need to undergo surgery for whatever reason to deliver baby, to diagnose, a problem, or even to treat infection or fibroids and all of that. Unfortunately, those things you cannot really avoid. But the question is this, having had this surgery should actually, make you think of things that may go wrong, especially if you then end up with a successful pregnancy. So in essence, the things you can avoid are the things within your control. But the things not in your control, actually the knowledge of how ectopic pregnancy can happen or present is what you're going to be, blessed with as such, so that, if things don't go well, then you can seek help immediately.
Okay, thank you so much. Now, I'm now a lady and I'm pregnant. When do I get worried about ectopic pregnancy, practically speaking? So when do I get worried? Because a lot of the time, a lady will say, I have abdominal pain here, I have this there, I have that. So the question will be, when do I get worried? When do I need to go and see my doctor? Or what are the signs I need to pick, and at what stage of my pregnancy?
So the way to look at it is, it's either you're expecting to get pregnant and you did. And if you did get pregnant, either by doing a pregnancy test, urine pregnancy test, that is good news in itself. But whilst you're waiting for, ultrasound scan, if you now start having pain, which is unusual, or irregular bleeding, that should make you seek help. It is not to say that those symptoms definitely suggest ectopic pregnancy, but the reason to seek help is to diagnose or to pick up a problem so that it can be treated early. Now, also as well, it might just be that everything is going fine, and then you just go for scan just to say, well, I know I'm probably about 6 to 8 weeks pregnant. Doctor, can you scan me to see where this pregnancy is located? That is the other place where ectopic pregnancy is being picked up on ultrasound scan. So, but also you may have just normal symptoms of pregnancy and then nothing really showing. But the key thing is that in order to diagnose ectopic pregnancy, the first thing that one might want to consider is ultrasound scan. Now, if you do go for ultrasound scan and nothing is picked up, this is where it can be followed with a blood test, which is called HCG testing. Now, the whole idea of that testing is to see whether actually there is a pregnancy, and then you can use the level of that blood test to inform other management plan that could happen later. Because what we say is that if you did a blood test, if the values are probably above 1,500, you expect to see a pregnancy, whether in the womb or somewhere, most times in the womb. But if you don't see a pregnancy in the womb, this is where it can be a bit concerning to say, well, yes, you have to have high index of suspicion for ectopic pregnancy. But most important thing is that if there's no pregnancy or mass or bleeding noted on the ultrasound scan, the whole idea of the beta HCG blood test is that when you repeat it in 48 hours time or thereabout, you'd expect that a normal pregnancy, the value kind of doubles, really. But once you're entering into that 2,000 rem and then you can't see a pregnancy, then, of course, ectopic pregnancy becomes top of your differential diagnosis.
Okay, thank you so much. So I know you've mentioned the investigations, and I think there's a question I'm trying to find an answer to based on what somebody's just asked there. That if I have a pregnancy, I have a lot of pain, I have pains, are pains during the pregnancy. Is it all the pains I have to be worried about ectopic pregnancy? Or just to allay their fear, because somebody's asked a question here, is it all the time that they have the pain, then ectopic pregnancy is going to ensue? Or are there things that we need to specifically, put an eye on?
So can I just say, not every pain is associated with ectopic pregnancy. Pain in pregnancy is quite common. Even some people have a bit of bleeding or spotting with early pregnancy. Those things are quite common. But if you do have all those other risk factors which I've talked about, this is what I'm saying if you've undergone surgery, if you've had an ectopic pregnancy before, and then or you've been treated for sexually transmitted infection and things like that, all those symptoms, although may be normal, but until you get investigated to confirm that the pregnancy is in the right place before we can assume that everything is okay. Most of the time, everything is okay, but you need that sort of evidence to support that before you can sit back and relax and say, well, I know everything is fine. I don't need to worry at all. So pain is quite common in pregnancy, even up until late in pregnancy. But in early stages with bleeding, and of course, other things you look out for, is this pain going at all? Is it worsening? Is it stayed on one side? What else makes the pain worse? Those are the sort of things that would trigger the need to seek medical help.
Thank you so much for that. Now, so if I now come to you as a gynecologist, and then this is the situation I find myself as a lady, I'm pregnant, it's been confirmed is ectopic pregnancy. You said earlier on, it can be a dangerous thing. It could mean a matter between life and death. Does it mean that's it? Or what will you do for me in terms of, maybe we can summarize the investigation and the treatment here.
So like I said, you could either stumble on the diagnosis of ectopic pregnancy, either in a bad situation, either because the woman is collapsed and then you scan and then see a lot of blood, that woman is rushed to theater. So, and this is the cases where you need to be, for any woman of reproductive age, like I said, any woman that's having periods, anything before 50 years old, and they present that way. Doing a pregnancy test alone, urine pregnancy test, being positive and a woman collapses, the first thing you think about is ectopic pregnancy, really. But unfortunately, this woman, you might need to end up in theater. But also, there might be other non-dramatic way of diagnosing ectopic pregnancy. And this is where it is shown on ultrasound scan. So ultrasound scan is your key tool here to diagnose ectopic pregnancy. Now, in terms of management, the management, of course, depends on the patient factor and the sort of resources you have available to you. When I talk about patient factors, it depends on how badly the woman is presented with ectopic pregnancy, because if I scan the lady now and I see a lot of blood in her tummy and I'm expecting her to be pregnant, I will be quite worried that ectopic pregnancy is ruptured. And if nothing is done, quickly, that woman could die from it. But also, when you pick up ectopic pregnancy, which probably is not ruptured, but causing symptoms, the other treatment options available are what I'm going to discuss. So you can have three forms of treatment. It could either be surgical management, it could either be medical management, and the last one is where it's more or less conservative management. And if I start from the last one, conservative management basically is like, yes, there is no pregnancy in the womb. Possible there's a tiny ectopic pregnancy outside of the womb. Now, the blood test, beta HCG level, is really quite important here. It has to be quite low for you to start considering this management option. But most importantly, that woman should have little or no symptoms for you to consider expected management, because it might just naturally, your body deals with it, and then therefore you don't need the other two management options available. But the key thing about conservative or expectant management, there has to be enough cooperation from that woman, in the sense that they need to present for regular blood tests, which is probably done on weekly basis. And also they need to have good access to healthcare. Or if things don't go well, they need to be able to access emergency care, especially when you think about the ectopic pregnancy rupturing and then they need emergency surgery. Now, the other one which I wanted to talk about is the medical management, where we use a special drug called methotrexate. Now, this is a really strong medicine or drug, as it were. And sometimes you may hear of that drug being used in maybe cancer treatment or even some other medical condition as well. The whole idea of considering this medical treatment might be in itself to save the woman from losing her tube and also, avoiding surgery. But that cannot be guaranteed all the time. Also, for the woman to be able to take this treatment, there are some eligibility criteria which we look out for, that the things that will make you give to a woman. It's either the ectopic pregnancy or mass is small in size, like I said, anything probably 3 centimeter or less. The hormone level beta hCG should not be high at all. And even when you pick up the pregnancy, there shouldn't be a heartbeat in the pregnancy. That's the ectopic pregnancy itself. But also, that woman has to be in good health. If you have any kidney problem or liver disease and all of that, that will make you unsuitable for methotrexate treatment. Having said that, it works well in most cases if ectopic pregnancy is picked up early. But also, it is important that that woman is going to be compliant. And when I mean compliant, they need to go for blood tests every week until that hormone level drops down to the barest minimum, where you know that they're not in danger anymore. But also, there's a small chance that during the course of treatment, the ectopic pregnancy may rupture and cause bleeding. And this is where it's important that that woman should have access to emergency health care, which in most cases is surgery, which is the last thing I'm going to be talking about. And when we talk about surgery, that means you picked up ectopic pregnancy, that woman is not suitable for medical treatment or expectant management. And in this case, it's either surgery that's needed immediately or you can plan still within a short frame of time. And in order to do surgery, the beauty of modernization these days is that things are done cheo, and that by that I mean laparoscopic surgery, where you have tiny cuts in the tummy, then they go in, confirm the ectopic pregnancy, which most of the time has damaged the tube, and as a result, that tube has to be taken out. But also sometimes also depending on the woman's condition, the desire for more babies and other factors that you may need to consider, it might just be a case of making a little nick on the tube and removing the ectopic pregnancy. And this is where you're doing that to save the tube, more or less. So removing the old tube is called salpingectomy, whilst trying to keep the tube, but removing the ectopic pregnancy is called salpingostomy. The other way you can do that, other than laparoscopy, is where the traditional way of cutting around the bikini line, which is called laparotomy. That most of the times may be needed if that woman is quite unstable as a result of a lot of bleeding into the tummy. And most cases, that's when the ectopic pregnancy has ruptured. But also, it might just be that there's no expertise available to do cheo surgery. And I know, I mean, of course, in this practice in the United Kingdom, almost everybody will be able to do cheo surgery. But when that is not available, this is where laparotomy comes in. The reverse might be the case in Nigeria because not many people are skilled to do laparotomy and laparoscopy, pardon me. And as a result, a lot of people may end up with laparotomy. What is most important is that picking up the problem and dealing with it in order to save the woman's life.
Right. Thank you so much. So that's quite elaborate enough. So if a lady now has a treatment, are there things to worry about in the future? As in, what are the side, the negative side to this treatment? I know we're advocating to prevent it, or it happened, we've been treated. Are there things that we need to be worried about for the future?
Well, there are two ways to look at it. The good news is that having an ectopic pregnancy doesn't mean it's a life sentence. So if you have 10 women that have had ectopic pregnancy, at least about, 8 or so will still have a pregnancy in the right place the next time, really. So, but there's also that possibility that ectopic pregnancy might happen again. And that's the reason why it's important. So for next time, if you do get over this pregnancy this time around, for the next time, yes, if there's a pregnancy, ectopic pregnancy coming back should be on the back of one's mind. But also, most of the time, you're going to be quite lucky and the pregnancy is in the right place. Now, The reason being that the problem that's led to the ectopic pregnancy in the first place may still be there, and that's why the risk factor does not really go away. And as such, you can only hope that things are right for you the next time. But then you need to access early pregnancy services or see your gynecologist for an early scan and then take it from there, really. Usually by about 6 weeks or thereabout, you should be able to see pregnancy in the right place. But also, even before you have the scan, if there are some concerning symptoms, like I said, we talked about pain, we talked about irregular bleeding. These are the things that would make one to seek help immediately. Now, in terms of what else could happen with a future pregnancy, it may just be in the right place, and then you may still end up having a normal, natural birth. But depending on how bad the ectopic pregnancy, if it's one where, like I said, in the corner part of the uterus, that's the top part of the womb itself. Sometimes some women might need to have a cesarean section as a result of treatment for ectopic pregnancy. But in most cases, women should still be able to achieve, a natural birth after treatment for ectopic pregnancy. Unfortunately, sometimes might just be that if for whatever reason you've had ectopic pregnancy on both tubes, which is very, very unlikely, unfortunately, there's no way that woman can conceive naturally. And in such cases, they may end up with IVF treatment.
Right. So, okay, thank you so much. Now, what will be your, as we'll be rounding up very soon, what would be your advice to the ladies and to Nigerians in general, and maybe to the governments? What are the advice you want to give us on what we do here and things?
So I know this is a public enlightenment program, and I really appreciate what you're doing with regards to improving the health of women in the country. For me, the most important thing for the women is the information. If you have the right information, then with that information, you can seek help and help appropriately as well. So knowing that ectopic pregnancy, yes, can be common, but it's probably only in few cases. But the thing is that if a pregnancy does not behave normally, then you need to seek help from a proper gynecologist, as it were, that will be able to diagnose the problem, i.e. offer you ultrasound scan, and if it is confirmed, offer treatment as well. I think in most cases, surgery might be what is available, but also cheo surgery. I don't know whether this is quite common in the government hospital, and this is where the government might need to invest more because it is a lot more beneficial to women. They tend to recover quicker, they have tiny scar, and then it's actually good for them in the long run rather than having to have a big scar in the tummy, which takes a while for them to recover and actually predisposes them to other problems, even another ectopic later on in life. So that might be an area where the government needs to invest in. But I know very well that most private hospitals that have gynecologists in-house, they have the skill and the expertise to provide all the three management modalities, i.e. surgery in form of cheo surgery, even offer methotrexate treatment, which is, like I said, a special drug, and or even the facilities for the woman to access and then be monitored with scan and blood tests to see whether the ectopic pregnancy is disappearing or not. So in summary, what is most important for a woman is the knowledge of the disease and when and where to seek help.
Thank you so much. So on the final notes now, to women. Obviously, we've been hearing Dr. Amu has been discussing ectopic pregnancy, which is, like we've picked, a very important topic, and very, very important, especially the fact that it could be life-threatening. We've picked the information here. What we do with the information next is up to us. And we need to be very responsible in our actions. He's talked about a lot of things around the contraception, around sexually transmitted diseases, healthy sexual life. and talked about quite a lot of things that we can, we possibly can relate to our normal lives. If we have questions, if there are things that are concerning that you think, you want to ask, you can always come back here, drop your question below. We're going to answer the questions one after the other. And I'll make sure that I draw Dr. Amu into that conversation every now and then if there are things complicated to answer from our side. So you have the opportunity, and then we play that, we're responsible to, with whatever we're doing to ourselves. Thank you so much, Dr. Amu. Do you have any other things that you want to wrap up before we round up the program?
Well, I just want to thank you for the opportunity to come and then be able to, help in this little way of mine.
Okay. Hello. Oh, hello.
Can you hear me now?
Yeah, we can hear you now. There was a bit of a glitch.
So I said thank you for the opportunity to do this, and thank you for what you're doing as well. For me, I believe information is key, and it's an empowerment for patients, and particularly women who are the ones that look after here. And also, when people are empowered, they're able to demand the change which they want. And the change here is the right treatment at the right place at the right price as well. And I don't think lives are to be lost needlessly to ectopic pregnancy, because scan, blood tests, and all those things are readily available and can be invested in almost all primary health care, as it were, and that's probably something government could look into as well.
Thank you so much. And it's been a pleasure to have you, on the program. And to the viewers, thank you so much for always being there. Without you, we can't do this. And I look forward to seeing you again next week when we'll come with another exciting topic. Thank you, and have the best of the weekend. Bye-bye.